You've had weight loss surgery and now you have COVID. What should you eat and drink? How does COVID affect your bariatric diet? Nutrition can play a definite role in your recovery, support your immune system, and have an anti-inflammatory effect. But you want to be smart in how you care for yourself. I'll share 5 nutrition strategies coming up.
Now available, try ProCare Health's 3 newest products at an amazing price. Get a bag of whey protein powder, a bag of our new multi-flavored mocktail calcium chews, and our new soft chew multivitamin, all for less than $75. Visit ProCareNow.com and enter Susan10 to save even more.
Hi, I'm registered dietitian, nutritionist, Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 108. Do you ever just feel overwhelmed by all the nutrition information on the internet? Most of it not even correct. I'm here to help you cut through that health hype BS, really, and give you the nutrition answers you want for your real life. Simple step-by-step strategies that can change your life now. This podcast is for you. Before we jump into nutrition for COVID, I have a fabulous giveaway from New Hope Girls. If you listened to the podcast last week, you know that I'm thrilled to be a partner with New Hope Girls. I love that transformation is a concept that binds us together. It honors our journeys and how we are all a work in progress. I know I am. Our messes, our hardships, our challenges do not define us. You are created for more. Our giveaway is a beautiful tote in the slate surface pattern valued at $62. You can register to win the tote in our random drawing by answering 2 questions and sending your name and email to contact us at breakingdownnutrition.com. And don't worry, I'll put this in the show notes. But again, it's going to be a random drawing, answering 2 questions, sending your name and email to contact us at breakingdownnutrition.com. The questions are, number 1, what do you like best about this Bariatric Surgery Success podcast? And number 2, if you could change something about the podcast, what would it be? Well, I'll put a photo of the tote and a link to newhopegirls.com where you can read more about the tote. And I'll put it all in the show notes along with how to register. So registration closes on August 12th at midnight. If you don't win, but you would like something special just for you or for a friend, New Hope Girls has given our bariatric community a code, Transform15, that you can use anytime. You can use it over and over and save 15% on your orders. Well, in the private Facebook group, which you're welcome to join, by the way, and I'll put that link in the show notes as well, or you can just search Facebook under Bariatric Surgery Success with dietitian Dr. Susan Mitchell. We were talking about what to do if you get COVID after surgery, because this has happened to some of the people in our group. How do you manage 6 days, especially if you're quite ill from COVID? If you've recently had surgery and you're nauseated, vomiting, you have diarrhea, you're short of breath, all factors that are going to affect your health, and that means affect what you eat and when, please check in with your healthcare team. See if they have someone on call to discuss your symptoms, let them know how recent you had your surgery, and discuss how you're going to manage these symptoms. And really, regardless of how far out you are from surgery, never hesitate to contact your healthcare provider if you have symptoms and you know you need answers and care. They may want you to take certain medications that may affect your appetite, and it could affect your appetite in a positive way. So, for example, if you are given a medication for nausea and vomiting, you may find that you can then tolerate your protein drinks and full liquids, even soft foods, after the medication takes effect. So here are 5 nutrition strategies to help you recover from COVID. Number one, did you know that 70 to 80% of your immune system is in your gut? Well, you may have heard it called the microbiome or maybe the gut microbiome. The gut is fond of high fiber whole grains, vegetables, fruit, along with kimchi and yogurt or kefir. All of these different food items help to keep a healthy microbiome. And so if you have a healthy microbiome, it's much more likely that you'll have a healthy immune system. Just remember though, if you're consuming yogurt or you drink kefir, you pour kefir on something, for right now, especially make sure it's plain or unsweetened, as the sweetened version might cause dumping syndrome due to that sugar content. Also, for the immunity and anti-inflammatory benefits, try to add vitamin C rich foods like any of your peppers, your bell peppers, your citrus if you can tolerate it, and any of the berries like blueberries, blackberries, strawberries, whatever you might have in season. Don't forget onions and garlic, or flax seeds, walnuts, fatty fish like salmon. All of these foods have an immune benefit or an anti-inflammatory benefit. So either or both. Number two, drink fluids and more fluids, which actually help thin your respiratory secretions. So no doubt, you already know this. You're drinking a lot of fluid because you've had surgery. This is a daily drill you're already very familiar with, right? But now these fluids also become a critical part of your care and your recovery, especially going back again to if you're nauseated, that's leading to vomiting, or you're having diarrhea, going back to fluids. And it may be that you need to include fluids with the electrolytes sodium and potassium, just depending on if you are vomiting and having diarrhea and how much. You can also try full liquids. Full liquids just means that the liquids aren't clear, so you don't see through it. And they usually have some food blended into them. And remember, even now, even with COVID, you want to keep the focus on including protein because it may be the only way you feel like consuming protein for a few days. So here I'm saying including protein in your full liquids, in your drinks. You don't want to lose muscle mass from a lack of protein in the diet. And also losing body fluids and then breaking down muscle affects the immune system. It affects your body's ability to combat illness and recover. So again, we're talking full liquids and finding a way to put protein into that full liquid, which we'll talk more about in a minute. But you can also, bariatric dietitians Gail and Isabel, who join me every few weeks on the podcast, and along with myself, I like this product too. I like protein waters such as Protein 2.0 or Protein 2.0 plus electrolytes. They have a number of different ones, especially if you're vomiting and having diarrhea. Now, this is not the only game in town by any means. These are just products that we happen to see and have success with. But I realize that if you're listening from another country, this specific product may not be available to you. But what you can do is check it out online so that you can see the ingredient label and then compare that label to what you find where you live and get something close to it. And full liquids, this may also be a time when you're ready to drink protein shakes, may once again become popular and your easiest option for a few days, depending on how you feel and what you can keep down. But that's considered a full liquid, if you will, with a protein in it. So keep some drinks close by so that you don't have to constantly get up and get them if you're resting. That'll make it much more likely for you to sip. And it may be just a little sip every 10 or 15 minutes. But the idea is to make yourself sip. Okay, number 3, playing off those full liquids again. If you're not using protein shakes, you can mix your protein powder into warm broths, into soups, into a hot drink. You can use soups with veggies and chopped meats and protein powder and then puree them quickly just to make it a full liquid. But if you can tolerate soft foods, that's okay too. Choose moist ones that you can easily chew in small bites and easily swallow. Especially, don't miss this, choose soft foods, moist ones, small sizes, small bites that you can chew and swallow easily, especially if you have a sore throat or you are short of breath. So these small portions, even if you need to eat more frequently, may work a lot better for getting things down. And number 4, has your taste or smell or both changed? There's a number of things that you can try, and different things work for different people. So try rinsing your mouth with a mixture of salt, baking soda, and water, and that'll help cleanse your taste buds. Or you can try chewing sugar-free gum. You can try sucking on a sugar-free mint, some of your stronger ones like lemon or cinnamon after eating. This helps to clear bad taste in your mouth. And then if the food feels like it's just so bland, you just can't taste it, you can add citrus, a squeeze of lemon, lime, orange. Citrus adds a pop of flavor. You can season. You can try things like onion, garlic. Remember, both of those are beneficial from the immune system standpoint, but also for flavor. You can season with basil, oregano, rosemary, vinegar, really whatever you like to try to perk up the taste. Now, maybe meat has an off taste right now. And if you notice that and you're thinking, ooh, this tastes odd, then switch it up temporarily and eat more fish or eggs or peanut butter, beans or dairy that you can tolerate without added sugars, any of those things to help you get the protein, but find something also that tastes good to you. So speaking of meat and off taste, it's not just meat that will get an off taste. A lot of times food across the board will taste bitter, or it might taste metallic. You see this a lot when we're treating cancer patients, the change in the taste buds and the change in the taste and the smell. So if the taste is metallic, believe it or not, try eating with plastic cutlery and cooking in glass instead of using metal. This will make a big difference. And then some of those flavors we just mentioned, like adding citrus or vinegar when foods are bland, they can also take away those metallic and bitter taste. Even a little bit of salt can decrease metallic taste. I am sure that you may feel totally overwhelmed right now, but the focus for you is to get over COVID, hopefully with no long haul issues. Do the best you can, but don't put so much pressure on yourself that you get stressed. Focus on you, focus on your self-care, and let go of perfection with your bariatric diet for right now. That's totally okay. So kick perfection to the curb and remember, you're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC, all rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions, which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.